Alright guys, so we have an immunology assessment, also known as allergic reaction. The main takeaway here is to be able to differentiate the difference between an anaphylactic reaction and a local allergic reaction. Diane is going to be our team lead. Danny Herman in the back is going to be your team member. Dan Bobbier is going to be the proctor. Kimberly is going to be our patient. And Marshall is going to be our family member. So Dan, can you start us off with the scenario?
Sure. So you guys are going to be dispatched to the allergic reaction, okay?
Okay. So I'll have my proper BSI on. Is the scene safe?
The scene is safe.
So this appears to be my only patient. Is this the only patient?
Yep, only one.
Okay, since you dispatched me to allergic reaction, my nature of illness, I would think, is immunology as of right now. And then I'm going to consider ALS. I'll probably have to call them later on, but I'm just considering them right now.
Okay, so you walk up to the patient and you notice that they're flush. They're leaned over just like that. You do hear some stridor and wheezes as you walk up. And you do start seeing some hives that are spreading.
Okay. Hi, my name is Diane. What's your name?
Kimberly.
Kimberly, nice to meet you, Kimberly. This is Dan, my EMT partner. And what seems to be the issue today?
I can't breathe.
Okay, chief complaint is can't breathe. Since she's responding to me, she is alert. I'm going to ask you a couple of questions, Kimberly, really quick. So you know your name. Your name is Kimberly, correct? Do you know where you are, Kimberly?
Yeah, the park.
Park, okay. Do you know who the president is today?
Yeah, Joe Biden.
Joe Biden, okay. And do you know what day it is?
Thursday.
Okay, so that ANO times 4. Okay, have you fallen today at all?
No.
Did you happen to have any trauma?
No.
Did you happen to have any neck, head, or back pain?
No.
Okay, since they don't seem to have any spinal injury going on, I'm not going to consider C-spine. And since they're looking, the conditions you presented to me are flush, tripod, stridor, wheezing, hives, and they look like they're short of breath and they're gasping, I'm going to say the patient is sick. I'm going to continue to the ABCs. So these conditions I listed before are signal signs of anaphylaxis. So I'm going to check for other signs of anaphylaxis as well as of right now. So I'm going to check to see, so I do hear stridor. Is there accessory muscle use?
You do see accessory muscle use.
Okay. They are in a abnormal tripod positioning. I'm going to take lung sounds really quick. Hey Dan, can you take a set of lung sounds for the patient? Can you show where you would take the lung sounds as well?
Go here in the mid-clavicular region, here, and here, mid-axillary.
And then you do two ways.
Here, and here, right below the nipple.
Okay. So those 6 spots. Do I hear anything?
You do hear wheezes bilateral.
Okay, so I do hear wheezes in the lung sounds. And then do I see widespread hives?
Are you guys gonna do anything? She's like not breathing.
Yes,
There's
I'm
so many
just
questions.
double checking so I could administer certain
can't breathe.
medication. Give me 1 second.
can't
A
breathe.
couple of things I need to check. Do I see facial swelling?
Oh my god.
You do see facial
And I
swelling.
see swelling in the peripheries. Okay, so
Are you guys gonna do
I'm
anything?
going to ask Dan to give epinephrine because the patient is in anaphylaxis from these 6 signs. Can you administer 0.3 milligrams of epinephrine?
Sure. Gonna expose the site, clean it with an alcohol wipe. I would be gloved up. Gonna go inward into the lateral, hold down for 10 seconds, pull out, massage the area, and then dispose it in a sharps container.
So I've now given epinephrine. I'm going to continue on with the ABCs. So I'm going to reassess for stridor, and I'll also be reassessing later.
Okay.
Do I still hear?
The stridor seems to be going away.
So it seems to be diminishing. Okay, do I hear any other airway obstruction sounds?
You still hear wheezing.
Just hear wheezing too? Okay.
I still can't breathe.
Still can't breathe? Okay, so since this is still short of breath, can you give high flow oxygen via a non-rebreather at 15 liters per minute?
Okay.
So can you set that up for me, Dan?
Sure.
Okay. And so I'm going to be checking for other the B's of ABCs. So for breathing, can I check for tidal volume?
Okay, the tidal volume seems to be adequate.
Adequate tidal volume, okay. Can I get SpO2?
Sure, it's 84.
84%. Okay, can I get a respiratory relative rate?
It is fast.
Fast, okay. Can I get a pattern?
The pattern is regular.
Regular. Do they still have accessory muscle usage?
Yes.
Okay. And can I take lung sounds again?
Sure. You still have wheezes bilateral.
Okay. Sounds wheezing. Okay. Let's say the patient has been, throughout the time I was talking and checking these things, the patient was on 15 liters per minute via non-rebreather. Since I do hear wheezing bilaterally after giving epinephrine, I'm going to ask my partner to set up a nebulizer kit via a neb kit, with 2.5 milligrams of albuterol, 0.5 milligrams of Atrovent. They'd be putting it in this little container here. And while they're setting that up, I'm going to ask them to connect it to 6 liters per minute of oxygen via oxygen tubing.
Okay.
And after they set everything up,
So is that how you want it set up?
no, I do not. Do you mind? So this T-piece, can you put that T-piece on here? And then on both sides, on each side, the tubing only goes one direction. And so we could see which side fits. So it doesn't seem to fit that side. And then that seems to fit this side, just like that. And I'm going to ask after he connects it to 6 liters per minute of oxygen, I'm going to ask the patient to breathe from, from the side with the plastic on it. I guess all of it is plastic. But I'd ask, Dan could show him.
breathe.
But yeah.
Why isn't the oxygen doing anything?
Yeah,
Come
we're
on,
about to give
guys.
us something that helps. It's going to allow the constricted
Breathe
bronchioles.
this through
Oh
the mouth
my
there.
god.
Sorry about that. Can you take slow and deep breaths for me?
I can try.
Okay. So after the patient is done with the medication, I'll be reassessing lung sounds. Right now they're still on medication, so I'll wait till afterwards. The
Okay.
patient does seem to be in respiratory distress, which is why we gave initially high flow oxygen via a non-rebreather, and then after we realized there's wheezing, we're giving a neb kit right now.
Okay.
So that was our oxygen management. Okay, so we're gonna move on to circulation now.
Okay.
So I'm gonna check for skin conditions.
Okay, so you notice that they are flush.
Okay.
The hives don't seem to be spreading anymore.
Okay.
And then they are diaphoretic.
Okay.
The temperature is still warm.
Okay. So I'm going to be reassessing later on to see if the highs are diminishing and if they no longer become diaphoretic after my oxygen treatment. So then I'm going to check the pulse. So the pulse, I'm going to take it at the radial artery since they are conscious. So that's by the thumb. And I'm going to check for strength.
Okay, it's strong.
I'm going to check for relative rate.
It's fast.
Okay. I'm going to check for pattern.
It's regular.
Okay. And I'm going to check for equality. What that means is I'm going to take both of the radial pulses from both sides, and I'm going to check that they're equal on both sides.
Okay, it is equal.
Okay? It's good to hear. Next, I'm going to take a cap refill. So what that means is that if I press down on the nail bed, as you can see, it turns yellow when I press down, or white if you have paler skin. When I let go, it quickly becomes back to pink in less than 2 seconds, which is a good sign. Is the cap refill of my patient less than 2 seconds?
It is.
Okay, that's good. So, since the patient was in anaphylaxis, this patient was in anaphylactic shock, so I will be giving shock treatment. I'm already putting them on supplemental oxygen via neb kit right now. I will also be giving them blankets to keep them warm, and I'm going to keep them supine, so on their back.
Okay.
And then, since they're not having a local allergic reaction, but they are in anaphylaxis, I will be transporting. So we're going to blow it and go right now. Okay. And then I'm going to go on to my secondary focus assessment before asking her a couple of questions. So this is my immunology focus assessment. Kimberly, do you mind if I ask you a couple of questions to start off with? Okay. Are you feeling any weakness right now?
Not so much weakness, but more lightheaded.
Sorry, lightheaded? Okay. Are you feeling a little dizzy too then?
A little bit.
A little dizzy? Okay. You said you had some shortness of breath before. Is it continuing? Is it subsiding?
The medications help.
Okay. I'll ask you again a little later after we finish the medication. Do you have any chest pain?
No.
No chest pain? And are you confused at all? Okay. And do you have any known allergies, Kimberly?
Yes, I'm allergic to bees and penicillin.
Bees and penicillin? Okay. What happened today when this kind of happened? What was happening today when this came upon?
I was on the swing set and a bee came up and stung me, and then this happened.
Okay, so she complained, she said earlier was shortness of breath, and then she also had a bee sting. Do you have any other symptoms other than what we kind of saw today? Okay.
No.
Did you try anything new today, such as any new foods, any medications, anything new that you haven't tried? No?
No.
Okay. And then have you done anything to kind of relieve your symptoms, such as took any medications?
Nothing except for the stuff you gave me.
Before you said that. Okay. And then I'm going to be reassessing to see if the patient is still in anaphylaxis. So do I see accessory muscle use still?
No.
Do I see abnormal positioning, so they don't seem to be in a tripod positioning anymore.
They're not.
They're not? Okay. Do I see facial swelling? Is it diminished?
You don't see facial swelling.
Do I see peripheral edema, which means swelling in the peripheries, like the arms and
No.
the legs? No. Okay. Do I hear stridor, which is swelling in the oil
No
pharynx and the
stridor.
lower pharynx? And then do I see widespread urticaria still, or has it diminished?
It's diminishing.
It's diminishing still? Okay. So they don't seem to be in anaphylaxis anymore, meaning our treatment using an epinephrine was good, so I was reassessing that treatment. And then I'm going to listen to breath sounds again, so can I take another set of lung sounds? I'm assuming the patient has finished the medication.
Okay, so it's clear bilateral.
Okay, so after giving 1 round of albuterol and Atrovent via neb kit, they don't seem to have any more wheezing, so I'm not going to be administering another neb kit. Are you still short of breath, Kimberly?
Not really.
Oh, really? Okay, that's good to hear. Can I take another SpO2?
Sure, it's 94 now.
So 94% now. Okay, that's good to hear. And then, since you don't feel really short of breath, would you like me to give you any supplemental oxygen? I don't think you really need it right
I
now.
think I'm okay for now.
You're okay for now? That's good. Okay, let me know if you're short of breath again, okay?
Okay.
So I'm not going to give any supplemental oxygen. And then I'm going to move on to history taking. So I'm going to ask you a couple of questions, Kimberly, if that's okay.
Do I need to go to the hospital?
So yes, you will need to go to the hospital. The reason why is because these symptoms, even though they might have been temporarily relieved from the medication I gave you today, they might come back. So this is like a life threat since it's closing up your airway.
Okay.
So we're just going to transfer you to the hospital so they could reassess you and assess you there.
Okay.
Is she gonna die?
No, so, well,
Oh my god.
I've managed
It's a life
to...
threat.
So these are just things that kind of affect her, like, systems of the body that are important, but I've managed them as of right now. We just want to keep a close watch on her,
Okay.
just because we
Okay.
want to make sure she's okay. Right now, I've managed everything that, and she seems to be in a stable state.
Okay.
Okay, good.
Sorry to worry you, but
Oh, I have no idea.
it's good to have loving family on scene. I'm going to ask you a couple of questions. So you said you have allergies of bees and penicillin. Any other allergies?
Not that I know of.
Okay. Are you taking any medication right now?
No, the only thing I'm prescribed is the EpiPen.
EpiPen? Okay. Do you have any past medical history that I should know about?
No, this happened once, but I think I was like 3.
Okay. And it was to a bee sting as well?
I don't remember.
You don't remember? Okay. And then what's the last thing you ate or drank today?
I think I had water maybe 2 hours ago.
Okay. And what was happening leading up to this? You said you were gardening and a bee stung you. Anything
I was
else?
on a swing set.
Sorry, you were on a swing set and a bee stung you?
Yeah.
Okay, so you're at the park. Okay. And then, did this come on suddenly or gradually, these
Very,
symptoms?
very suddenly.
Very suddenly. Does anything make it better or worse?
What you gave me helped a lot.
Okay. How would you describe this pain, uncomfortability, shortness of breath?
Like the worst allergic reaction ever.
Okay. And then on a scale of 1 to 10, with 10 being the worst pain / uncomfortability, the worst you've ever felt, how would you describe it?
A 10.
10. And when did this come upon? Like how long ago?
Maybe 8 minutes ago.
Okay, 8 minutes. Okay, any other additional symptoms I should know about?
No.
No? Okay. That's good to hear. Okay. And then I'm going to take a set of vital signs right now. So can I get a BP?
Sure, your blood pressure is 130
130
over 86.
over 86. Can I get a heart rate?
Your heart rate is 122.
Can I get a respiratory rate?
You're at 20 now.
Can I get a blood glucose level?
It's 78.
Okay. Can I get another round of an SpO2?
It's 97 now.
And then can I take lung sounds again?
Sure, so you're clear bilateral.
Okay. Okay, so my field impression was they had anaphylaxis. Since it's potential that they could go back into anaphylaxis, we'll be reassessing every 5 minutes. As we transport to the hospital, we will be reassessing the ABCs. We'll also be reassessing relevant vitals, which include SpO2 as well as lung sounds. We're going to check our interventions, so I'll be reassessing whether the patient still has anaphylactic symptoms, such as if they're flushed, they go back into abnormal positioning, if they have stridor, wheezing, and hives, or any sort of swelling. And then I'm also going to be, once again, checking wheezing and the lung sounds to reassess our neb kit intervention.
Okay.
And then I'm going to ask the patient, are you feeling any better, Kimberly?
I'm feeling a lot better.
Any additional complaints you have as of right now?
Not yet, no.
No? Okay, that's great. That's great to hear. We're going to be transporting right now, and I'm ready to give my oil report. Oh, sorry, one more question for you, Kimberly. I forgot to ask you your age. What's your age?
21.
21, and you are a female, correct?
Yes.
Okay, so this is a 21 female with a medical-related issue. Okay, I'm ready to give my oil report to the hospital. Hi Northwestern, this is Ambulance 3. We're incoming with a 21-year-old female who presented with anaphylaxis. Upon initial patient size up, we noticed the patient was flush in a tripod positioning with stridor, wheezing, and widespread urticaria. The initial SpO2 was at 86%, and they also had wheezing bilaterally with facial edema and peripheral edema. They were, however, ANO times 4. Upon finding these symptoms, we administered 0.3 milligrams of epinephrine via an EpiPen. We also reassessed lung sounds, finding that they had wheezing that persisted in their lungs, so we administered 2.5 milligrams of albuterol, 0.5 milligrams of Atrovent. After administering these medications and reassessment, the lung sounds were now clear and signs of anaphylaxis diminished. Relevant vitals include one BP at 130/86, a heart rate at 122, a respiratory rate at 20, a blood glucose level at 78, SpO2 has risen to 97%, and lung sounds are now clear bilaterally again. They have an allergy to bees and penicillin, and events leading up to this was they had a bee sting. They do have a medication prescribed to them of an EpiPen, and we are around 5 minutes away. Anything you would like me to add? I would like also initially add that they were short of breath initially, so we also gave them 15 liters of high-flow oxygen before giving them a neb kit. Afterwards, they did not need any more supplemental oxygen.
Okay, how's the patient doing now?
They are doing fine after reassessment.
Okay, great. We'll see you soon.
Okay, see you soon. Bye.
Awesome job, Diane.